got to have money in the present political situation. You've got Welcome to the New Orleans Humanist Perspective, presented by the New Orleans Secular Humanist Association, following our few principles of humanism.
We're committed to the use of science and reason for understanding the universe and for solving human problems. We're skeptical of untested claims of knowledge, but we're open to new ideas.
We are concerned with securing justice and fairness in society and in ending intolerance and discrimination. We are committed to the total separation of religion and government.
We affirm humanism as a realistic alternative to the theologies of despair and the ideologies of violence. We reject the concept of an afterlife and believe in living a full and rewarding life here and now.
We value and respect each individual's right to judge and lead their lives according to their own position, as long as it's respectful of other people living in a free society.
We hope you enjoy today's program and others in the weeks to follow. Hello, folks. You know me. I'm Harry Greenberger, host of the show. Today, I have a very interesting guest whose name is Timothy Kemery, LCSW, and I'm going to let you explain that later. But this is what I was able to find out about Timothy. It says, Timothy Kemery, LCSW, has worked in research for the last 14 years in the capacity of sub-investigator. That's with the Louisiana Research Association, is that right?
That's correct.
He has conducted research in the following areas of depression, Alzheimer's disease, pain studies, schizophrenia, bipolar disorders, and attention deficit disorder studies. He has been involved in phase 1, 3, and 4 clinical trials. In addition, Tim has been engaged as a rater or coordinator in at least 30 trials. Tim is also responsible for study-related documents such as regulatory. Now, tell us what, following your name, LCSW, what does that mean?
It stands for Licensed Clinical Social Worker. And so my degree, my professional degree is as a master's degree in social work, which I got from Tulane University. And I've basically been in private practice in social work for more than 30 years. And 15 years ago, I started a research company in order to be able to conduct clinical trials for new investigative medicines, and that's what we've done. We've got some doctors and staff and so forth, and we team up with pharmaceutical companies who have a drug that they are interested in advancing, and by advancing I mean collecting data and information about the efficacy of the drug as well as the healthfulness of the drug, whether or not it hurts people, do they have adverse events, and how effective is it, and what are the
and these are drugs related to what I just mentioned. They're not physical problems. These are more in the realm of
sometimes they are. We've worked in a variety of areas, but primarily it's going to be in the area of neuroscience and psychology, psychiatry.
All right, well, you used the word I was looking for, neuroscience.
Right, that's correct.
Okay, all right. So you're involved with the testing of drugs, and what else in that organization do you do?
Well, I'm involved in the actual testing and measurements, mostly now as a rater. But I also have a business position in the company, and I'll seek out the trials and talk to pharmaceutical companies and attract new business.
Now, you also are a consultant in your clinic in the West Bank of New Orleans.
That's
right?
correct. That's correct.
And what sort of people with what sort of problems do you consult?
Well, we do like free evaluations for people who are, for instance, worried about their memory in particular, because that's something that is a real need in the community. And I have a private practice, so I'll see just couples, individuals with depression or anxiety, and I work with the court system, helping people with divorces and divorce mediation and child facilitation, parenting coordinator, and so I have a busy life, and I'm also on the board of the Alzheimer's Association. Local board, working board.
Well, let me say this, that my organization, the New Orleans Secular Humanist Association, if you attend one of our meetings, you will see that most of the people there are middle-aged or older,
Mm-hmm.
and we all have some concerns about Alzheimer's.
Yes.
And the topic that I most wanted to talk to you about is memory.
Very good.
Now, just a few weeks ago, you were scheduled to give a talk at the Vista Shores Assisted Living Facility,
Yes.
which is a few blocks from where I live.
Mm-hmm.
And so they send out some notices and invite the people in the neighborhood. And so I went over to hear your talk, and they advertised it as what is normal memory loss and what is not. And I wanted to hear your explanation. It just happened and I was there at their facility with some other people, but it happened that day we had severe flooding.
I remember it well.
And you contacted them and said you couldn't even get through the streets.
I could not.
So they have rescheduled it.
That's correct.
But that's when I became aware of you and your topic of memory. And you were going to say, what is normal memory loss and what is not? So now the floor is yours. Tell us about that.
Thank you very much. When I was thinking about coming here today, and I mean I knew the topic that was going to be addressed, and I was trying to frame it in a way that people would more easily understand, why this has become an issue and what to do about it. And I think what we need to do is to be able to think about the bigger picture. It's like when you see on TV or in a movie, there'll be a scene on a street or whatever. Then the camera starts pulling back, and it pulls back, and it's going up above the buildings, and then up above the clouds, and then back and back and back, and then you see the earth. And it's like when you talk about memory, you are up close to your brain, because that's where things take place, right? And so as you back away from the time frame of today with your brain and whatever problems or difficulties you may be having, and you pull back, and then you look at what happens to our brain over our life cycle, and we all know that when we're born, our brain is there, and it's alive, and it's working, and it continues to work and grow and develop through childhood and adolescence into young adulthood. And at some point in young adulthood, it's like a turning point, and things can sustain and grow and get better. But there's also like an inevitable process where things are beginning to wear.
But I understand from what I read and hear, we only utilize a small part of our brain capacity. So why does it start wearing out?
Well, it's like anything else. I was at a party last night, and somebody said, "Boy, I need to go sit down." It was a stand-up party, and there was going to be dinner, and there was 5 or 6 people standing around. I said, "How many of you people have noticed that with the passage of time, your propensity is to want to sit down more often?" And everybody laughed and said, "Yeah, that's exactly right."
This was a party of middle-aged and older people.
Oh, middle-aged and older people, mostly in their 50s and 60s. And so the idea is that our bodies just wear. When you think about it, genetically, we seem to be designed like many other species, to be able to grow, thrive, reach our reproductive years, reproduce, live long enough to raise, the offspring, and then once you're done with that, maybe biologically and historically, you've sort of fulfilled your purpose. And so you'll usually find that the reproductive years and the years shortly after that are the more robust periods of your life. And if you look at scientists and people that have made major intellectual contributions, often it's something that's done very early in their life rather than at the end of their life.
But don't some people maintain this acute mental ability into very old age?
Absolutely. No. That's not. I'm not trying to say that you're going to lose it. I really feel like one of the problems that we have is that as people get older, there is a thought process that memory loss is an inevitability, and while it happens a great deal, it doesn't happen to everybody to a huge extent. Some people are fine. My mother was fine into her 90s. I mean, she drove until she was 93 or 94, and then she had a decline. And you can see there was, you can look at older actors on TV, and you can see they're in their 80s and 90s, but they're walking, they're active, they're alive. And my point of looking at
are they having trouble remembering the lines?
Well, sometimes yes, and sometimes no. Carl Reiner was on the Sunday morning last week, and he's 93 years old.
Yes.
And walking and very bright. I'm sure he has some challenges with some of his cognition, but he was still sharp, could still sing, could still remember, a lot of current and past facts, and was very, very engaging. And what happens with people when they develop a progressive amount of loss of cognitive function is that they become very inward towards themselves and less interested in what's going on around them.
Well, let me ask you this. One of the signs of Alzheimer's early on is a memory problem.
Correct.
How do you distinguish between
It's a good question.
normal loss and a loss of memory that could be predicting the onset of Alzheimer's?
Okay, I think that what you need to know is that our brains function differently at different points in our lives. When it's, for instance, if you want to learn a language, that's best to learn your language when you're very young.
Yes.
You can do it, but it just takes longer. And the older we get, our brains still function very, very well. It is an unbelievable organ, and the most unbelievable complex organ in our body. It's one of the last frontiers for medicine and science. Just a quick fact. There are probably 100 billion brain cells in our brains. And each one of these, the brain cells, not all of them, but most of them have what they call synaptic junctions, and they're little things,
Yes.
little lines that come off that collect neural impulses.
And they connect with each other.
Yes, they connect with each other. So when you total them up, it's like 500 to 1,000 trillion synapses.
Say that number again.
500 to 1,000,000, 500 to 1,000 trillion, 1,000 trillion
In one human's brain.
in one human's brain. And so when you think about it, and they'll relate this to the Library of Congress, which has maybe 70 trillion bytes.
It would seem to me, with that many connections, synapses,
Exactly.
that you could lose a lot of them and still have total capacity.
Precisely, and that's really what happens. And there are many factors. Let me just say this: there are many factors that are predictive of Alzheimer's disease.
That's what I'm interested in.
One of the factors is simply age, because 1 out of 8 people who are 65 will develop Alzheimer's. 1 out of 2 people will develop Alzheimer's after the age of 85.
Well, now you've got me worried.
Okay,
You don't know
listen,
it. You don't know it. but I am over 85 years old.
That is amazing.
And I've got a 50-50 chance of Alzheimer's. Is that what you're telling me?
Yes, but I'm saying that's just statistically. But in order to really address that for you, you would have to look at a lot of other factors. And that's why this is becoming much more complex. But I mean, it's like, is there Alzheimer's disease in your family, which is usually very difficult to tell. I mean, I was fortunate enough to have my parents live until the last 10 or 15 years, and so we knew a lot more about Alzheimer's disease. I can remember my grandparents. My grandmother had dementia but I don't know whether it was Alzheimer's dementia or whether it was vascular dementia, because there are different types of dementias.
All right.
And the causal factors are different. So I'm gonna back off and I will address all of those as best I can. So with the progression, the normal progression of brain life, if you have gone to address your last point, if you've gone to college and if you've been an intellectually stimulated and involved person in your life, you have probably elaborated many more synaptic junctions and neural complexities in your brain than people who have not had those experiences. This is generalization. So what that means is, as you get older and as our brains age, and as there is some sort of loss of efficient function, our brains are shifting around and trying to redo things and balance things. So if you have a traumatic brain injury, a lot of times you relearn things.
Yes.
And what that means is, when you relearn things, is that you develop other new neural pathways to accomplish those things. Do you see what I'm saying?
But are you saying that the people who may have advanced college degrees and use their brain more are more or less likely to develop Alzheimer's?
I think what it actually means is you are going to prolong your period of productivity much longer than people who don't have that. And so rather than developing cognitive problems in your 50s or 60s, it might be your 70s or 80s. And because what's happening is you're compensating for it. It's like you're not noticing a real loss, a significant loss, because your brain has been is so much more complex in its structure, and it's able to create new neural pathways to be able to respond to whatever challenges are going on. And the challenge might be not a challenge like what we normally think of a challenge. It might be like you like to read books, or you like to work crossword puzzles or whatever. And you might be able to do that with much greater efficiency over time as a result of.
Is there presently any kind of test or measure that would say, for instance, my serious memory loss is or is not preliminary Alzheimer's?
Yes, the answer to that is yes, and I think you have to be able to approach it in context. So, and this is one of the problems. People will come in and say, "Well, I'm really worried about myself and my memory and so forth," and we want to do testing and stuff. When you give someone the results of a test, you have to be able to explain to them what those results really mean. And for instance, a person who has memory loss that is normal for the aging process, it's not normal for your brain, but it's normal for a brain that's aging. Do you see what I'm saying? There's a slight difference there. And you will be able to see that. You see it in yourself. I see it in myself. And it might be not being able to remember a name, or not being able to retrieve things that are there.
Yes.
I mean, it's as bad. It's like it could be on the tip of your tongue.
It's frustrating.
It's very frustrating. And so in conversation you have to compensate for that, right?
Exactly.
And so you try to
talk around.
You know where you're going. You know where you're going, and you want to make that point, but you're never going to be able to get there because you can't remember the name of that
word. Yeah.
So you go around it and you go in a different direction.
All right. Now you say that there are tests. Do you do that? Do you give such tests?
We can do those. We can do preliminary screenings. But what I want to say is, so you can look at a person, you can have trouble retrieving memories of names, of places, of people, of movie stars, and on and on and on. They're in the filing cabinet, but you can't get them out. That is not an uncommon thing. People even have a name for it. It's a senior moment where you
senior moment. I don't like that.
I don't like that either. But I mean, that's how people accept those kinds of aberrations in our
It's
thought.
putting a pretty picture on an ugly situation.
Lipstick on a pig, huh? Well, yes, and I agree. But you can live with that and not suffer any real loss in your function. So
Yeah.
you can have those things go on. It's still not going to interfere with your ability to use the remote for your TV or to learn how to use a new app on your phone. It may take you a little longer than it takes someone who's 17 years old because their brains are more supple and more reflexive and reflective. I mean, it's much easier for them to be
I
able
don't
to
have any
do the
apps
process.
because I don't think I could handle it. Okay?
Well, you never know till you try. But the idea is that you're driving, you're having social functions. Some people can still be at work and perform tasks and functions without significant problems. So that's memory loss. Now, when you go a step beyond that, there is an area of which there's some discussion, but it's generally accepted that it's called mild cognitive impairment. Now, when you get to mild cognitive impairment, it's not just memory loss, because memory is a part of cognition. It's not all of cognition. So you begin to find other things going on where there may be like disorientation, like you're in a familiar place, but it doesn't seem familiar to you. It seems alien or mysterious. Or you're driving and you're in a familiar part of town, but it doesn't look familiar to you. It may quickly come back. It might quickly come back, but it's like, so there's a spatial orientation thing that's different. And there are other things that go on. It's like your ability to draw geometric shapes and do things. It's like a visual perceptive thing. Those things can change. And so as our bodies age, in addition to this, with driving, you have visual changes, auditory changes, and now spatial changes. And so that's when some people have to stop driving. And then your ability to retrieve information and your ability to hang things together in chains means that you have difficulty with functions. So you might not be, you could just sit down there and maybe make red beans without any problem in the past, but now you might be challenged to, did I put this in it, or should I put this in it? So
I understand that problem too.
And so then you have the real problems with the remote, particularly when they start changing channels and changing functions. And can you remember the DVRs when they first came out? They were impossible. Digital video recorders. It was very, very difficult to work those. And now if you change from Cox Cable to like DirecTV or vice versa, you have a new remote with different functions and buttons that operate things differently. And it takes a long time with numbers of repetitions, successful repetitions, to actually get that. So, but if you translate that into a work situation, you have the inability to extract memories. You sometimes have speech problems where you can't find the right word. You sometimes have difficulty following a conversation and it's not because of your hearing. You have difficulty following a conversation, and so you might end up asking the person questions about things they've already spoken about. And so if you translate that into a work circumstance, then you have someone who is not able to function at the same level they did previously. So that's really important. And then there's also a question of judgment, because all of these are interconnected areas that affect our presentation to the world and our perception of the world. So the importance about judgment is, would they know how to take care of of a problem in your house, whether it's a leak or a small fire or whatever. Would they know what to do? Would they wander into dangerous circumstances?
Yeah, but you're talking about a severe case. Now, people.
Well, no. What I'm saying, I'm just trying to say that mild cognitive impairment affects people in a variety of areas, but it's an insidious process. It is a gradual process, and day to day it may be not noticeable at all, or maybe even week to week. But month to month or quarter to quarter, yes, it is obvious.
All right. So if someone comes to you for an evaluation, I assume you ask a lot of questions.
We do.
And based on the answers, you determine whether this is normal memory loss or maybe some
Correct.
Stage of Alzheimer's. Is that correct?
Well, no. Here's how it goes. There's normal memory loss. There's mild cognitive impairment, where you find the changes, the cognitive changes in a variety of areas,
which are not necessarily precursors to Alzheimer's.
No, that is absolutely correct. That is not necessarily the precursor to Alzheimer's, but it could be. But here's the thing. Then you have early onset, early stage Alzheimer's disease, middle, final, and we can just trace our steps back, because you can think of it this way: early Alzheimer's disease. It's like a child who is like 10 years old, and you go from early, middle to late, when they just simply go right back to their diapers and they pass away.
And you are able to make that classification after?
The classification of early stage Alzheimer's disease is now a lot easier than it ever was. And it's true because you don't just use cognitive tests. You also use lab tests, and neuroimaging, MRIs and PET scans. And in the MRI and the PET scan, you can actually see formations of different types of structures, outside of the cells as well as in the cells. But you can actually see it, and it's a conglomeration of things in the spaces in between the cells. Squeeze the cells, hurt the cells, injure the cells. They don't function as well, and they die.
All right. Now, we're almost out of time, but when you're talking about these the MRIs or whatever, is that something you do, or you send someone out?
Yes, in all of the testing that we do for the drugs for Alzheimer's disease, neuroimaging is one way to be able to assess the existence of it, and to be able to, over time, indicate whether or not your drug has reduced that.
And you have the facility, or you send people out?
No, we send people out. We send them to
that.
Turo or one of the hospitals.
All right.
Well,
an organization that I support, which is Death with Dignity, can't do anything for you unless you're in serious stage of Alzheimer's.
Right.
How serious, do you know how serious you have to be before it's considered debilitating?
Well, I think one of the things that I need to point out is that, in my role in the Alzheimer's organization, Alzheimer's disease, because we raise money for research and other things, Alzheimer's disease has no cure. It's a terminal illness, and more people die from Alzheimer's disease than any other illness. And it hasn't always been listed as Alzheimer's disease, but the idea is the later stage Alzheimer's is generally when a person needs to have somebody with them all the time.
Okay.
But that period can last from 1 to 5 years.
Our time is up.
Okay.
Thank you very much.
You're welcome very much.
Thank you, folks, for watching our show. We hope that you will be back with us again soon, and don't forget there are many ways that you can actually see these shows.
Tell you that the type of tests we give